Cyanotic spells are episodes of worsening of cyanosis, also called hypercyanotic spells and TED spells for short, in infants with cyanotic congenital heart disease with low pulmonary blood flow. This group of cyanotic congenital heart diseases are known together as tetralogy of Fallot physiology. TED spells can also rarely occur in adults with tetralogy of Fallot. Cyanotic spells are associated with hypopnea and may lead to loss of consciousness and even hypoxic seizures if the episodes are prolonged. They can be precipitated by crying or other forms of exertion. A rare instance of refractory cyanotic spell in a patient with tetralogy of Fallot due to thrombus in right ventricular outflow tract has also been described. Thrombus occurred following intravenous iron sucrose therapy for iron deficiency, which is known to worsen hyperviscosity symptoms in tetralogy of Fallot. Proposed mechanism for cyanotic spells are increase in contractility of the infundibulum, enhancing obstruction and thereby right to left shunt, and immature respiratory center causing hyperventilation bar hypoventilation, hypoxia, vicious cycle. Another mechanism suggested is mechanoreceptor stimulation from the right ventricle. Increased contractility of right ventricle due to catecholamines and decreased right ventricular volume can trigger reflex hyperventilation and peripheral vasodilatation and initiate a spell. Conventional treatment of cyanotic spells or TED spells is sedation with morphine, keeping in knee chest position, oxygen administration, hydration, and intravenous propranolol. Knee chest position compresses the femoral arteries and veins, thereby enhancing the afterload and reducing return of desaturated blood from the lower limbs. Enhanced systemic afterload reduces right to left shunting across the ventricular septal defect and enhances the pulmonary blood flow. Use of intranasal midazolam in an emergency situation in an infant with difficult venous access, as the child was deeply cyanosed, crying and hypopneic, has been reported. Intravenous access could be easily obtained after termination of the spell. Another case in which cyanotic spell in tetralogy of Fallot could be relieved by intranasal fentanyl has also been reported. An interesting case reported manual auto-transfusion of blood from aorta to pulmonary artery for a refractory cyanotic spell occurring in the cardiac catheterization laboratory. Blalock Taussig shunt is useful in preventing cyanotic spells refractory to medical therapy when immediate surgical correction of the cyanotic congenital heart disease is not feasible. Cyanotic spells can occur due to dynamic left ventricular outflow tract obstruction in infants with detransposition of great arteries and intact ventricular septum. Worsening of outflow tract gradient with isopropanol and relief of obstruction with intravenous propranolol has been documented in these cases. First set of references on cyanotic spells. Second set of references on cyanotic spells. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.